As you all can see, I'm joined by a number of senior leaders in the United States government addressing this response. And let me take a minute to introduce them. With me this afternoon is the Secretary of Health and Human Services, Sylvia Burwell. Also with me is Dr. Anthony Fauci from the National Institutes of Health, Administrator Raj Shah from the U.S. Agency for International Development, and finally, General David Rodriguez, who is the commander of U.S. Forces Africa Command. As the president has said, we are not facing just a health crisis, we are facing a national security priority. And it's one that he has instructed his team is as important as any threat we're facing. Since this outbreak began in March, the president has directed that we scale up our response, both here at home and in the countries affected in West Africa. And that's exactly what we've done. Most recently, by deploying United States military members to Liberia and to the region to support civilian efforts on the ground. Today, we are using a whole of government approach and response to control this epidemic at its source. And that's evidenced by the people who are here with me today at the podium. We're doing a number of things to address this epidemic at its source in West Africa, first and foremost. We are also enhancing our domestic preparedness and ability to respond to isolated cases here in the United States. And as importantly, we are rallying the international community to contribute to this response. And that was seen most recently when the president spoke at the United Nations last week, and when we had an unprecedented vote in the UN Security Council to contribute and to show galvanizing forces of the international community to contribute to this response. The strategy the United States is executing has four key goals: to control the epidemic at its source in West Africa, to mitigate the second-order impacts of this epidemic, to lead a coordinated international response, and to build a robust global health security infrastructure so we are prepared over the long run to confront epidemics such as the one we're facing today. I think it's very important to remind the American people that the United States has the most capable healthcare infrastructure and the best doctors in the world, bar none. And it's why people travel from all over the world to receive medical care here in the United States. Finally, I want to emphasize that the United States is prepared to deal with this crisis, both at home and in the region. Every Ebola outbreak over the past 40 years has been stopped. We know how to do this, and we will do it again. With America's leadership, I'm confident, and President Obama is confident, that this epidemic will also be stopped. So with that, let me turn the podium over to Secretary Burwell.
Thank you, Lisa. Since the outbreak began, the United States government has been engaged in preparation both at home and abroad to protect our homeland and stop the epidemic at its source. We've been working for many months to ensure that the United States is protected. CDC sent out our first guidance to state and local officials on July 28th, and it's been followed with 6 additional sets of guidance, and the latest was just issued yesterday. In addition, we have enhanced our surveillance and laboratory testing capacity in states to make sure that they're able to detect cases. Been in regular and repeated contact with state officials and health departments, including developing guidance and tools for departments to conduct public health investigations. We're continuing to provide guidance for flight crews, emergency medical service units at airports, and Customs and Border Patrol officers about reporting ill travelers to the CDC. And we're continuing to work with hospitals and healthcare workers around the country to prepare most effectively, both in terms of detecting symptoms and then responding appropriately. As we saw just a few months ago, almost 2 months ago, in Carolinas Medical Center in Charlotte, North Carolina, and at Mount Sinai in New York. Hospitals and healthcare systems reacted and took appropriate steps. Fortunately, in those cases, the cases were not positive. We saw MRE's ability to handle the first cases that returned from West Africa, followed by the Nebraska Medical Center's ability to do the same. In Dallas,